No, because I've been up since 6 o'clock. I've seen patients on.
It's getting hot in here. Hi, welcome to the Avaaz Podcast with Dr. Madhu, Dr. Nav, and myself, Roop. We are here to talk to you about South Asian women's health issues. And today in particular, we're going to be talking about sexually transmitted infections, formerly known as STDs, which was sexually transmitted diseases, and now it's infections. So let's talk about what this means to South Asian women in particular, but also in general, how you diagnose it, what the symptoms are, and how you treat it.
Well, let's talk about it from the South Asian stance first. I think it's underdiagnosed, and I think there's a lack of awareness. I think that sometimes people come in, and I've unfortunately seen it, I'm sure you have too, where they feel they're in monogamous relationships, and then they have breakouts or they have signs and symptoms of infection. There is no doubt that it's sexually transmitted. So I think the onus also falls on us to screen better as primary care providers when someone has like some burning or some discharge or something like that. So I think it's important too that we are aware of it as South Asians and as the primary care providers for South Asians that we screen for it better.
Yeah, and nowadays women are much more sexually liberated and active than we were like decades ago, generations ago. So this is a very relevant topic to all age groups, as Mother's mentioned, certainly for younger generations, but all generations should be aware of the fact that STIs occur and how to diagnose and how we treat them.
And both
they're fairly
sexes.
common, aren't they?
Mm-hmm.
They are. That's what we're going to talk about them.
Yeah. They're fairly common, but we don't often talk about them
Because it's sexual in nature, and in our community, in our culture, we don't talk about sex.
No, we don't talk about it. It doesn't exist. That's one thing.
Somehow we just all magically appear, and it's not a story. So one of the ones I've heard a lot about is chlamydia, but I don't really know what it is.
I think we can talk about chlamydia and gonorrhea together because they're usually tested together. So I will give it to the ER doc here.
Yeah, because I do see a lot of it in the ER. So chlamydia and gonorrhea are both sexually transmitted infections that can be spread through sexual contact, whether it's regular vaginal intercourse, anal intercourse, or even oral sex. So they're both infections that create similar symptoms and can cause similar complications, and they're tested together. So that's why we're talking about them together. So the biggest thing here is that in the vast majority of women, they're asymptomatic. So as a woman, you won't know that you have this infection. Yeah, so that's
70% of women. And I've seen it in labs.
know ever that you have the infection?
Well, you might once we talk about the complications, but at the time you may not know that you have been infected with chlamydia or gonorrhea unless you've been tested. Men will get more symptoms, and so they get tested, and sometimes that's how we know that the woman should also get tested. But let's talk about what some of these symptoms are when you do get them. So in women, you may get a little bit of vaginal discharge, not very much. It might be a little bit of discharge more than usual. You might get bleeding either during intercourse or during a time when you weren't expecting to be bleeding. You might have pelvic pain, like lower abdominal or even like low back pain, and then pain during sex, or what we call dyspareunia. And in men, they might present with like itchiness at the tip of their penis, which is called the urethra. They might present with either a clear or a milky discharge from the tip of the penis. And one other thing that I see often in emerge is testicular pain or swelling. So they might come in thinking, oh my gosh, I've got like a twisted testicle or testicular torsion. But in fact, it most often ends up being an infection of the top part of the testis or even the whole testicle itself because of a sexually transmitted infection. And then in both sexes, it can present as painful urination.
Yeah.
And
burning.
yeah, exactly. And then also, depending on the method of how it's transmitted, people can get symptoms in the rectum as well. They can get rectal pain or rash. They can get symptoms of the eye. They can get discharge of the eye. They can get a sore throat. They can get swollen lymph nodes either in the throat or in the groin area. And so we diagnose that by testing the urine or doing a swab of the vagina or the urethra in men. And it's treated with antibiotics. Very easy to treat, very commonly treated. And the dangers of these two infections are that they can cause complications down the line. So in women, they can cause pelvic inflammatory disease, which is a pelvic infection that can cause scarring up into the uterus through the fallopian tubes. And that scarring can cause infertility down the line.
Wow.
Yeah. So it's a really big cause of female infertility. And in men, as we mentioned, it can cause epididymitis or orchitis, which are infections of the parts of the testicle that cause swelling and pain.
Yeah.
Does it cause infertility in men?
Rarely.
Yeah.
Rarely. It's
So-
mainly in women it can. So when you have undiagnosed PID, pelvic inflammatory disease, and that's what it is. It inflames all the stuff in your pelvic, your fallopian tubes, and so the implantation or where the sperm and the egg meet, which is in the fallopian tube, then they can't, and that can be a cause for infertility.
And for women, you test the same way as you test with men.
Either the urine or you'll do a vaginal area swab. Yeah. So those are the main sort of complications, and prevention is easy. So even if you're using contraception in the form of birth control pill, that is not going to prevent this. You must use condoms.
Mhm.
Is that the only way to prevent
Yeah.
sexually transmitted infection?
Yeah.
Or not have sex.
Or not have sex.
And also, it can cause another complication that we should mention is that it can cause problems in pregnancy if it's not diagnosed and treated. You can have a miscarriage. You can have early
delivery, like preterm delivery, preterm birth,
Yeah, and the infant when it's born can develop infections as it's going through the birth canal.
like an eye infection or pneumonia. So it is something we really do need to be on top of and screen. And so when women are pregnant, and this is, we've talked about this in a podcast with prenatal checkups, we do screen for chlamydia and gonorrhea as part of routine prenatal health care.
That's great.
Yeah.
And there needs to be some safety for the
Yeah.
baby, right?
Yeah, and that is the reason, because it is in 70% of women, it's not, they have no symptoms.
Mhm. And keeping in mind that, when you diagnose sexually transmitted infections, we almost always also treat the partner. So we tell the person that has been diagnosed that they should also notify any sexual partners they've had.
In the last
in
60 days.
Mhm.
Yeah.
And public health will often follow up as well.
So maybe this is my question. Let's just say a male is diagnosed, he's married, and he doesn't want to tell his wife that he's been diagnosed because that would then lead her to conclude that he's been having sex outside the marriage. How will she know?
If he doesn't tell, she won't know. There's a 70% chance she won't know because she won't have symptoms.
But if she suspects, she should get checked for her own health.
Absolutely.
right?
Absolutely. Yeah, absolutely. And some men are a little tricky. They'll go, oh, well, I have this itch. You should get checked. There's probably something in you. That's happened in my practice.
Okay.
So
And
they
can you get a sexually transmitted infection from anything other than sex, like sitting on a dirty toilet?
no. Sorry, no. That's just,
Yes, because I'm sure that some people might.
yes, they're saying they get bladder infections or yeast infections from sitting on a dirty toilet. That is false.
Okay.
Okay.
What's another common STI?
Well, one thing we're both seeing an uptake in
yeah,
is syphilis.
Yes.
It's
Yeah.
made a comeback.
because that seems like something you would
It's back
see
in
in
the
an old movie.
early 1900s. Yeah.
Isn't that King Henry?
And
He has
Captain
syphilis?
Yeah.
Yeah.
Jack Sparrow.
Yeah.
It's coming back. Why
So
not?
again, this is spread through unprotected sex, oral, anal, vaginal, whatever. It's and it can, again, we screen for this in prenatal checkups because it can be passed from the mother to the baby, and it's something that's so easy to treat, but the complications are horrific. So I'm going to let Dr. Nav take over the different. There's a bunch of different stages. I don't know. We need to go through all of this.
Yeah, we could just kind of touch on them because I think, it's still not a super common infection, but it is enough out there that we should tell our listeners what people will be watching out for. So in the first sort of few days to few months, you might get a small sore at the site of where the infection occurs. And this is the point where men may present with a wound or a sore spot on their penis, for example. It might heal up, they're like, well, there's nothing to it, and it's gone. But then what happens is because the infection is still in your body, there's a secondary phase that lasts from like starting 6 weeks after you get the infection till about 6 months afterwards. And then you kind of get these vague flu-like symptoms, muscle aches, rashes, especially like on the palms and soles of your feet, which is different than other viral rashes.
Yeah.
You might get patchy hair loss, muscle and joint pain. It's kind of non-specific is what we call
Yeah,
it.
like the headaches and stuff. It is very non-specific.
These are symptoms you found in men, right?
And women.
And women.
Yeah,
For both.
Yeah.
Yeah.
You might get swollen glands, like fever that you can't figure out why you're having it, why you're losing
So
weight.
they're sort of non-specific, but sort of really important things. So when you're being worked up, that is one of the things that needs to be tested for. And I think as care providers, the onus is on us to test people before. I don't think I paid as much attention, but it has had an uptick.
Yeah, we test for it routinely now in the ER for patients. And then the third stage of syphilis is what's always been shown in movies. So the stage where it affects your brain. So you get neurosyphilis and you have psychosis, and it causes neurological problems. It can even cause death. So it's not a disease or an infection to be taken lightly. Syphilis is in the communities, in various communities around North America, and I'm sure around the world, and it does need to be considered as part of the differential diagnosis when we have people coming in with nonspecific symptoms who may or may not remember having had a small initial wound.
And so again, how to prevent it? Use condoms. That is the only way. And how do we test for it? We can swab the sores, or you do a blood test. So those are the two ways of doing it. And the treatment is pretty straightforward. You get penicillin injections. So you cannot have oral penicillin. This requires you going. So I have had to do this for one of my patients who was diagnosed with syphilis, and it was in the latter stage, not the last stage, but where it was the flu-like symptoms, the body aches, the swollen glands, and an internist screened them for it, and we were both surprised. And it was an older person. So you can't just assume that if someone's 80 years old that they may not have syphilis. It can happen at any age. And they were treated with penicillin, and they're completely fine now. And then you do follow-up testing, and obviously notify partners and all that.
How soon after unprotected sex with someone who carries one of these infections would some of these symptoms appear? Is it weeks later, months later, years?
That initial wound, like 3 days to a few weeks.
Yeah.
Okay, so you'd know pretty much.
Yeah. And you would know once you've been diagnosed, you would notify partners for about the last 3 months or so is what the current recommendation is.
Okay.
Yeah.
So you can't say it's something you had in your early or late teens and it's just popping up now. No.
And the reason we test pregnant women, because it does carry very severe consequences in pregnancy, including fetal death, birth defects, developmental issues. So that is why we screen for it.
Okay. Are there any other infections, sexually transmitted infections that you see in the ER or in your family practice?
I think both of us see this for initial presentations. There's lots more, but let's talk about herpes, because we both see that, and it's very telltale it can be very telltale.
Yeah.
So I'll let you start with this, since you probably see this in Emerge a lot.
I do, yeah. So first of all, herpes, we're talking about herpes, and it's caused by the herpes simplex virus. There's two types, right? So there's HSV1 and HSV2. HSV1 is usually the kind that causes cold sores.
Yeah.
That's not genital herpes, which is HSV type 2. Genital herpes is the one that's sexually transmitted.
Yeah. So let's be very clear. So if your partner has a cold sore, or you have a cold sore, that is not a sexually transmitted disease. So it is a herpes. There's lots of different herpes viruses, but we're specifically going to talk about the one that is sexually transmitted, which is generally HSV2.
Yeah. And up to 70% of the time, that particular infection is transmitted through what we call asymptomatic shedding. So if you have it, you will shed the virus without any clear indication that it's been shed. So when you transmit it to your sexual partner, they will get it without knowing sometimes that you even had herpes in the first place. So what happens is the very first time you have a herpes outbreak, a genital herpes outbreak, it'll be quite painful.
Yeah, very painful.
Yeah, and you'll start out with a kind of like a flu-like illness for a few days before. You're like, my glands are swollen in my groin. Why am I feeling so unwell? And then you'll likely get this rash breaking out, which may only be 1 or 2 spots, but it also might be all over the outside.
Yeah, it can be just 1 or 2. That's true. I've seen it both ways, 1 or 2 spots, or it's just a full-blown breakout. Yeah. And it's very, as a healthcare provider, you know.
Yeah.
And we do swab it to confirm, and then we treat it.
Exactly. Yeah. And it's always the first episode that's super painful. After that, though, it will recur, and it can recur at times of stress, physical stress, or other stress, and it can occur in less painful episodes, but they're also going to cause you to potentially transmit it to other partners. So always make sure that you're treating it with antivirals, and then make sure you're telling your partner, and again, use condoms.
Yeah.
Okay, question for you guys. So when you have syphilis or gonorrhea or chlamydia, once you treat it, it goes away? or is it always in your body?
So gonorrhea and chlamydia, they're treated, it's gone away.
Okay.
Syphilis as well.
Yes.
But
too?
there's no cure.
It reminds me of chicken pox.
Well, that's the type of
Which is also a
herpes virus too.
A different herpes virus.
Yep. So what happens with this is you treat the acute symptoms and you sort of calm the virus down. But that virus, once it's in you, it's not leaving. So it comes and flares up and it goes away and flares up and goes away. And so that's why in some people, they'll only take the medication when they have a breakout and they'll know. In other people, we give them a pill every day to keep it at bay.
But their partner must still be protected with a condom in order to.
When you, and now correct
Because of
me if
asymptomatic shedding.
Yes.
They should always use condoms.
Right.
Yeah.
And very important now, we talked about this again in our prenatal care one, is that for women who have herpes, if they have an active lesion at the time of delivery, that will be a C-section. You will not have a vaginal delivery because you can pass the herpes virus on to the newborn and that creates serious consequences. So again, really important to be aware, be tested, and inform your sexual partners.
Mm-hmm. Painful.
Mm-hmm.
Painful
It is.
lesson, I would say.
Yeah, that one's a painful one for sure. And I do see women, middle-aged women coming in with a first-time onset of herpes. And so when they ask where they got it from, I have to give them a straight answer. Like they got it from their sexual partner, even if they're in a monogamous relationship. Hint, hint.
Okay.
Moving on.
I mean, like that's the reality, right? And we don't want to hide it. We do want to shed light.
Shed?
I know,
Or
back of a barrel, everybody. Want to shed light on some of these conversations that we don't normally have in our households, but they are important because they affect our health and obviously the health of a partner and the health of a fetus if one was pregnant.
So should we touch on the two sort of common ones, both of us?
Yeah, let's do that, yeah.
So two things that we see, and I think our listeners will also know about them. It's bacterial vaginosis and yeast infections. So do you want to start with BVAG?
Yeah. BV for sure.
BV.
So BV is it's a condition that causes a vaginal infection, which isn't necessarily a sexually transmitted infection per se, but it basically occurs because of an overgrowth of the normal bacteria that grow in your vagina. So your pH of your vagina and your body changes, and then
For whatever reason.
for whatever reason, exactly. It could be medication, it could be food, it could be environment, and then this overgrowth of bacteria cause
Some
symptoms.
discharge.
Yeah.
And some women say it's a fishy odor.
Yeah.
So
So it's still kind of a clearish discharge, but it's more than usual, a bit of a fishy odor, and it can be sexually shared, even though it's not considered an STI.
So once we treat the woman, I
Yeah.
find very often they go, but it came back again. And so
Yeah.
just recently they're saying you should also treat the partner if it's coming back and forth. So it's not really an STI in terms of promiscuity or something like that. There's a change in your own body. You get it, but then you can pass it
Now,
back
your
and forth.
pH is the acidity in your body.
Correct.
So
Yeah.
that's changed. You're getting
Yeah.
some more vaginal discharge than normal.
So I just want to make that clear to our listeners. Just because you have BV does not mean that your partner has been, not faithful to you or something like that. This is a infection that can happen on its own, whether you're sexually active or not. So that one right
Yeah,
here.
how do you treat BV?
Antibiotics, either
Very easy.
intravaginal or oral.
Yeah,
It's really easy.
treat.
Another one, which I'm sure all of us have had and maybe don't want to admit to, is the yeast infection. You're very itchy. There's white cottage cheese-like discharge, easy to treat.
Mm-hmm. Yeah.
Also with antibiotics.
And antifungal. So like either vaginal ovules, which will kind of dissolve inside the vagina as they work topically, basically, or by mouth. There's medication that you can take one time or a few times.
And a cream, like a vaginal cream, right?
Do you need to treat the partner of this person?
I think it's similar to BV, right?
Definitely not unless there's a reason or if there's going back and forth, then yes. Very similar to BV, actually.
Mm-hmm.
Wow.
Yeah.
HPV. Can we touch on HPV? Because kids in high school now are getting immunized for HPV. Tell us a little bit about that one.
So HPV is obviously the human papillomavirus is what it stands for. The kids are now getting immunized in British Columbia, which is where we're based, they are. I'm sure it's true all over North America and Canada. 75% of sexually active Canadians will contract HPV. The highest rates is between age 15 to 24. basically, HPV is important because it can cause cancers. So we want to prevent cancers, and it is a sexually transmitted virus. Um, it's spread via oral, vaginal, any sort of sexual genital contact, rarely at birth. Symptoms can be genital warts. Uh, they can be the cancers, which don't have symptoms. That's why we screen for like cervical cancer and so on. And the prevention, again, is the vaccine, which is really important to be vaccinated, and condoms.
Okay. Anything else that you're seeing in your clinic or in your emergency room?
So something that may not affect the general population as much as some of the sexually transmitted infections we've mentioned, but still we see are things like HIV, and then hepatitis B and hepatitis C.
Yeah.
And those are all either sexually transmitted or transmitted through blood and body fluids, through intravenous needles, and that sort of thing. So, but sexual transmission is a mode of transmission for both of them, all three of those.
Okay, so there's a lot of infections you can get if you are not protecting yourself.
And one I want to mention is that trichomoniasis, which is also, it's the most common non-viral sexually transmitted infection in the world.
I've never even heard of it.
Yeah. So I don't see it that much. Do you?
No, not anymore.
Yeah, we don't see it that much. But again, it is sexually transmitted. And the symptoms would be you have sort of I think it's a greenish yellow discharge, pain. And this is for men too. They'll have a painful urination. For women, it's the discharge. And again, some people don't have symptoms, some people do, but it is also easily treated with oral antibiotics. You would treat all sexual partners. And again, what's the prevention? Condoms.
Seems to be an underlying theme here. Usually in our podcast episodes, we talk about the benefits of healthy eating and exercising and not drinking a lot of alcohol. But today's lesson is use a condom if you're actually having sex.
Yeah, even if you're using birth control. Yeah.
Infection.
That's right. Yeah.
For sure. So can you share with the listeners what some of the most effective ways are to prevent sexually transmitted infection?
Should we say the first one together?
Sure.
Ready?
Yeah.
Condoms.
Yes. Period. Use them consistently and use them properly. So yeah, make sure you're using them the right way.
And I mean, limit the number of partners you have if you can. I mean, that's your choice. But I think if you basically more of a monogamous trusted relationship, there's less chances of sexually transmitted infections. But yeah, that was what I would say.
And if you're in a new relationship with a trusted partner, you both should get tested for STIs at the beginning of your relationship.
Yeah.
Right?
And I appreciate it when my younger patients come in and they actually say, well, I'd like to be tested. I really applaud them. I think it's great. So regular STI screening is a good idea in certain populations.
And there are vaccinations available for several of the things we've talked about today, like HPV and for hepatitis B. So if you can get vaccinated, absolutely do so.
And just avoid sexual contact when you think you are, like you have an open sore. You think you might, like if you have a yeast infection, if you have an open sore, if you have a herpes breakout, avoid any sexual contact.
And finally, just be open and communicative with your sexual partners. Like tell them about your sexual history, tell them about any past history of infections, let them know so that you can make joint decisions together. And again, that makes you more likely to use condoms. It makes you more likely to use condoms, but at least you're protecting yourselves, both of you.
Having a sexually transmitted infection does not make you a bad person.
Yes.
But what you want to do is you want to prevent the bad infection.
And you want to prevent the potential long-term consequences of having an infection, right? Especially for women with pelvic inflammatory disease and it potentially affecting fertility. But I think what we can get from our discussion today is for the highest protection is vaccinate where you can, as Dr. Nav mentioned. Use condoms, get regular testing, and open communication.
Yeah. Great way to summarize today's topic, which was sexually transmitted infections. Thank you for listening. We really appreciate when you write to us with your feedback and your suggestions for other topics. If you have any questions, please don't be afraid to reach out. We'll include some tips in our show notes, and we hope you'll follow us on Instagram, Facebook, Twitter, and watch us on YouTube. Thanks for joining us. The information in this podcast is not a substitute for professional medical advice, diagnosis, or treatment.